I'm Dr. George Cartalian. I've been with Townsend Orthopaedics since 2004, and I specialize in lower extremity work from the knees, foot, and ankle. An ankle fracture is when one of the three ankle bones is broken. There can be any combination of three bones that can be broken as well. And so fractures usually occur when there's a twisting injury or a fall from a height. Ankle fractures can occur in any of the three bones of the ankle. The ankle can be described as having a fibula, a tibia, and the talus, which is not shown here. We also describe ankle fractures as having a malleolus, or the bump that you can feel on the side of your leg. So the outside bump, we call it a lateral malleolus fracture. The inside bump is the medial malleolus, and that can be fractured. And then in the back of the ankle, there's what we call the posterior malleolus. There can be any combination of these malleolus fractures together. Ankle fractures are often caused by a slipping or twisting injury, or they could happen from a fall from a height. We see them in sports injuries as well as just missing a step in the house. More severe injuries can happen from a car accident or, say, a fall from a ladder. The most common ankle injuries that we see are what we call malleolar fractures, or the bump on the side of your ankles. This is a model of a right ankle, and this would be the bump on the outside of your ankle. The most common injury is a lateral malleolus fracture, but sometimes you can have the medial malleolus injured as well. We call that a bimalleolar fracture for the two parts. The ankle joint is made up of three bones put together in a way that allows motion but also has stability. When treating an ankle fracture, the principles are to restore the anatomy to try to minimize chance of getting arthritis in the future, and then you have to also restore stability of the structure. Therefore, when you're treating them, you have to first restore the bony anatomy, but then you also have to keep an eye out for any kind of ligament injury that may have happened. An example of a common fracture that is seen is when there's a lateral malleolus fracture combined with instability of the ligament in between the two bones. And the treatment often involves placing a plate and screws to first restore the anatomy, restore some stability, but then we have to do another procedure to bring the two bones together, as seen demonstrated here in this model, where the plate and screws hold the fracture, and then a device between the two bones secures the two bones together to restore the stability as well as anatomy.